Hi everyone, I hope you're all coping with lockdown okay, and that you've got the time now to listen to my next little tutorial. So I was really surprised actually that this particular topic about combining at-home treatments with in-clinic treatments was, I think, the winner. It got the highest votes. So thank you all for voting. So I was really surprised about that. So here goes, I hope you enjoy. Now, just to warn you, the beginning of this presentation is a little bit more technical and a little bit more scientific than the previous tutorial on the at-home masks, but bear with me, stick with it. There is method to the madness, so I'm hoping by the end of the presentation you'll see why I kind of delved a little bit into the science to start with. Okay, so I think it's really important to be able to understand what is going on the deeper levels of our face when it comes to aging. So, a lot of clients will come in and say, oh, my face is dropping and, I don't like my skin and I feel like my skin's really wrinkly, and so they'll come in with all these different concerns, but it's only by understanding what the aging process is doing to the deeper layers of our face that is going to help us work towards restoring it. So in terms of the bony changes, so that's the deepest layer of our face. Now you can see, if you can have a little look at the picture, this on the left is a more youthful bony structure, on the right, and the on the left is an older bony structure, and you can see that the top jaw here, or the maxilla, and the lower jaw, which is the mandible, have actually shrunk in size with the aging process, and the whole face is kind of rotating inwards. So we've had volume loss in the temples, we've had volume loss in the front of the cheeks, and everything is coming inwards like that, with the lower jaw kind of coming outwards and everything folding in. And moving up slightly, you can see on the left is detailing that the yellow areas are actually showing the fat pads. And you can see that as we age, the lower eyelid fat pad is becoming much thicker, and the top eyelid fat pad is becoming much narrower. And actually we're losing a lot of those plump, juicy fat pads, which is going to have given us that really nice youthful appearance to the face shape. So this is what's going on in the deeper levels of our skin. And now you can see all of the main 5 layers of the face. There are more, but the main 5 layers of the face. And you can see actually how we are going to systematically correct each of these layers of the face with these non-surgical treatments. So layers 4 and 5 are what we've just really been having a look at: the bone, the facial spaces, the real deep layers of the face. And that's what we're going to correct with our dermal fillers. We're going to replace that bony volume that's been lost, and we're going to reshape the structure of the face with dermal fillers. Then moving up, you've got the 3rd layer, which is the muscular layer, and that's going to be corrected with something like Botox. Layer 2, so this is the layer just underneath the surface of the skin, and we can use superficial dermal fillers here, things like Profilo to remodel the skin boosters, and various different radiofrequency and HIFU machines. And then this brings us to the final layer, which is layer 1, which is the skin itself. And that is what we're going to focus on for the remainder of the presentation, because this is the layer that we can treat with both at-home treatments and in-clinic treatments. So, last bit of technical information is the aging of the skin. So remember, this is our final layer, layer 1. And layer 1 is what is damaged with UV rays. So UV rays and sunlight are going to damage these skin cells in layer 1, in the outer layer of the skin, and cause them to become dysfunctional. We're going to see lots of skin cells collecting on the surface. The skin is going to become thicker, drier, more dull in terms of the complexion, and have larger pores as well. And instead of on a microscopic level, instead of the skin undulating, going up and down, it's actually going to become very flat. And that means that less oxygen can pass into the skin cells. So they're going to become less oxygenated. And the summary of all of these things can be summarized with the term inflammaging. And it represents a chronic inflammatory process that's happening in these skin cells. So chronic inflammation. And that is what we have to target and address in terms of our at-home and in-clinic treatments. So the best way, as I've just mentioned, to combat this inflammaging is this two-pronged attack, home and clinic. And in the clinic is the phase where we have to apply controlled injury. Controlled injury is going to go some way into repairing these damaged, dysfunctional cells. And at home, we're going to be doing the restoration and the regeneration. So, still in layer 1, we're going to stick with layer 1, the skin, and this is what we're going to do in the clinic. This is the phase where we're going to create this minor controlled injury. And we can do it chemically with the use of chemical peels, or we can do it physically with something like microneedling and mesotherapy. So chemical does what it says on the tin. There's plenty of different formulations of chemical peels, and that would very much depend on your skin and your goals and the advice from your practitioner. The microneedling is physically making little tiny injuries into the surface of the skin, and we can also microneedle vitamins and minerals and skincare products into the skin using this microneedling and mesotherapy technique. And then you've got your LED light. And we keep coming back to LED light. It's been around for generations, and it will be around for generations more, because the evidence just keeps building about how successful LED light therapy is, particularly in combination with these other treatments, so the chemical peels and the microneedling. And this is the section where we come to the things that we can do at home in combination with the in-clinical options. So this is the repair and restore section. And I want to really make this clear. Some of these sort of products I specifically didn't mention in the at-home mask presentation, because these are not the types of products that you should be using without the guidance from a practitioner. These are the types of products that should be put together in a specific bespoke treatment plan for you, alongside the other non-surgical treatments that you're having, because they are strong and they can cause damage, and you won't get the most out of them if you are not guided by somebody who knows these products and knows what's going to suit your skin. So then you've got the options like medical grade skincare, prescription strength medical grade skincare, things like strong retinols and hydroquinones, etc., etc. You've got at-home chemical peels like the Peel to Glow, which is a real antioxidant, and that can be used in combination with the chemical peels that you're using in the clinic. You've got these alpha-ret exfoliating pads, and again, this is really focusing on getting that top layer of the skin off that's damaged and dead. And you've got the salicylic acid and glycolic acid, which are both really going to be wonderful for exfoliating the skin and repairing the skin as well. And you've got Light Stim, which is actually an at-home use LED light. It's a handheld, you can see it in the picture there, and it's wonderful at being able to repair and restore the skin cells. And the LED light is most effective when it can be used 2 to 3 times a week. So the in-clinic option is just not enough. And then you've got something like Skin Aid, which is an at-home drink, pure marine collagen, and it's really going to be repairing and restoring the collagen levels, and therefore it will help with getting the most out of the treatments that you're doing in the clinic. So just to try and summarize and make sense of that, I'm going to use our lovely patient here called Lucy Lockdown and show you an example of the kind of treatment plan that can be put together. So Lucy Lockdown is 50 years old. She looks a little older than that, if I do say so myself. Medically, she is fit and well, so that's great. And this is the treatment plan that was put together for Lucy Lockdown. So phase 1 to 2 weeks before any treatment started, she began with her skin aid, really boosting those collagen levels so that she can get the most out of the treatments. And she started on a medical grade skincare regime. Then, a couple of weeks later, still as part of phase 1, she underwent her Botox and fillers, and that's really to address the deeper layers of the skin, layers 4 and 5, deeper layers of the face, layers 4 and 5. Then she moved into phase 2. She did a series of 4 chemical peels, actually 4 weeks apart, combined with the LED light therapy. She used a really enriched medical grade moisturizer for the 2 to 3 days after the chemical peel, as well as a Clinisept, just to keep bacterial levels down and to really help restore and repair the skin. And she was put on a strong medical mineral sunscreen. And then in between her peels, in addition to her medical grade skincare and her skin aid, she started on the Alpha Rep pads and the LED at home light. So that's going to be keeping up with that exfoliating effect that she gained with the chemical peels and keeping the cell turnover high with the LED light. And this was Lucy Lockdown after her treatment plan. So I would say miracle transformation. Anyway, just to finish, the reason why I wanted to go through that treatment plan was because I wanted to try and illustrate the benefits of putting together a comprehensive, holistic treatment plan, combining in-clinic and at-home treatments, thinking systematically about every layer of the skin and addressing each one of those layers. If we leave one of those layers out and we don't address the skin or the deeper layers, then we are not coming up with a comprehensive approach and we will not get the best outcomes. So it's all very well having a wonderful kind of in-clinic regime with Botox and fillers and, Profilo, but if you're neglecting that first layer, that skin layer, then you are still not going to get that powerful, non-surgical anti-aging result that we're all looking for. So I hope you enjoyed that. Please direct any questions to me on the Facebook group or private message me, as I know a few of you have been doing. And I hope to speak to you all soon.